Okay, well, hopefully people will continue to join, but we will get started since it is a little after 1. Welcome everybody back to the Village Square. My name is Malia Sanford and I am the Programs and Outreach Manager at the Lopez Island Library. And today's program is a conversation with representatives from the Lopez Island Medical Clinic. We'll be hearing from Ann Presson, the superintendent of the Lopez Island Hospital District, Crystal Rovente, who is the clinic manager here, and Dr. Bob Wilson, who is the doctor at the clinic. And as always, we'll hear just a quick update from our County Council representative, Jamie Stevens. But since we're happening from the library, I wanted to give just a few quick updates on behalf of the Lopez Library. Our building remains closed to the public, but we continue to offer our grab and go materials pickup in the community meeting room. Our regular grab and go pickup hours are Monday, Tuesday, Thursday, and Friday from 11 to 3. And then on Wednesdays, we're open later until 6 o'clock. And then we also have Sunday hours from 2 to 4 when you can pick up your materials. For the upcoming holiday week, we recommend that you plan ahead for your Christmas weekend needs by checking out items earlier in the week. We'll be open on Christmas Eve, Thursday, normal hours, 11 to 3 for pickup. And then we'll be closed from Friday through Sunday. And then check out our website for more info about our New Year's week holiday hours and other great content. We are continuing to answer our phones Monday through Friday, 10 a.m. to 4 p.m. So feel free to give us a call if you need help finding an item in our catalog, checking one out, or signing up for a library card. We do have a program coming up on Monday, December 21st. Stanley and Kip Greenthal will play a virtual winter solstice concert from 7 to 8 p.m. You can watch it by going to the Lopez Island Library's Facebook page. You do not need to have a Facebook account to watch the concert. You can just follow the links to the program that's on our website. And as an additional treat for this program, Vita's restaurant is offering a special takeaway dinner of shepherd's pie and winter slaw salad for purchase prior to the concert. So call Vita's if you're interested. And for those of you with kids and grandkids in your homes, the Lopez Library is pleased to announce that we have partnered with the Parent Teacher Student Association to create a games library with over 70 games and active toys for all ages available to check out with a library card. So to find out what games we have and for direct links to the games collection, just head to our website once again. And now for the main event, we are first going to hear from County Council Representative Jamie Stevens. And I forgot to mention that as usual with these Village Square programs, you're welcome to submit questions throughout, and then we will be addressing them at the end of the program. So using that Q&A button at the bottom of your screen, you can submit a question. Okay, Jamie, take it away.
Thank you, Malia, and thanks for inviting me today. And I'm going to be very brief. What's going on in the county is we are shifting, obviously, to not only prevention, but shifting into figuring out how we're going to do vaccinations. It's kind of, I'd say the mood and the feeling is much like we were back in April and May when there's a whole lot of unknowns and a whole bunch of people needing some clarity on on what the virus was and how we could protect ourselves and how could we bring an end to it. And it's a similar thing, and it'll probably come out from our clinic. There's a lot of, the vaccines are out, but there's a lot of unknowns as to how many, how much product will be available, when it will be available, and the guidance from the CDC and the state seems clear until you boil it down and try to figure out what it means on the ground and how we implement it. So to that end, the county's health department has put together a policy group which involves not only government, but healthcare workers and others to kind of, but not too big of a group so we can make decisions. And one of the things is to make sure we use high ethics, to make sure that in the distribution of the vaccine, that we make sure it's equitable and serves the people highest in need first, and definitely addresses the underserved communities in our county. Plus, it's also going to be coordinating, as our health department has had weekly calls with all the providers in the islands so that everybody understands what the other group is doing and who they are serving. So to that end, we're looking forward to moving forward on this, but I just have to say to everybody, think of where we were back in April and May, because it's a similar thing. We know what we want to do. However, there's a lot of unknowns and it will change consistently. So if you say, well, wait a minute, I thought you told us last week, why are you changing it? It's just because we're going to adapt and move, and I hope you can too, with the situation as it unfolds. Additionally, part of this policy group is if, for instance, if we're trying to make sure first responders get covered, and we only get 100 vaccines and there's 125 people, how do we figure out who the last 5 people are, or the last 25 people are? So those are some of the things that we're going to be tackling. Also, the federal government has a contract with CVS, and I can't remember if it's Rite Aid or Walgreens, to do our congregate housing, which is usually senior housing. And so we're going to be looking forward to see how they are going to roll that out in the islands. And with that, I will wrap it up. Thank you.
Okay, thanks, Jamie. Good info there. Next, we're going to hear from Ann Presson about the hospital district.
I'm sorry, I want to just I have to run out to look at, actually, I'll be right back. I apologize. Sorry.
Okay, Bob.
Thank you. I'm very happy to be here today alongside my healthcare partners. It's a privilege to see the community, and as was indicated, I'm the superintendent for the Lopez Island Hospital District. I also serve in that same role on Orcas Island. And basically the function of the hospital district, as many of you know, those of you that own property and pay property taxes, we do collect a portion of those property taxes, and we use that revenue to support healthcare on the island. Bulk of that goes towards the primary care clinic in the UW. And we are very fortunate to have an amazing group of folks working there, and very happy that this year we recently completed our second clinical services agreement, a 3-year agreement with UW. So we're happy they're going to be here for many years to come, and we'll be able to continue to partner with them and support the work at the clinic. We also provide a subsidy to Lopez Island Physical Therapy. And in addition to the subsidies that we provide, we work very closely with the other entities on the island that deliver healthcare in various forms. So whether that's Lopez Island Pharmacy, the Family Resource Center, who supplies amazing social support, or the EMS organization, and working with the Fire Commission and soon to be the new fire chief, which we're really excited to get to meet him. And so we look to create kind of that connected link to everyone that's serving the community and make sure that we're able to provide the additional support that might be needed. As Jamie mentioned, part of my other role is I have been working at a county level to support some of the COVID activities over the past year. I will actually be participating in that policy group that Jamie mentioned. And I just got off a call earlier today that I ran, which is a group that is coming together across the islands to study. We received a $100,000 planning grant to look at how do we, what are the gaps and how can we fill those gaps to ensure that our most vulnerable seniors can stay on the island and age in place. And we know that there are a lot of challenges with that as it relates to workforce development and affordability, and a variety of other complex issues. And we have a group of about, there are about 12 of us and several from Lopez. We have some representatives from Orcas. Lopez Island Fire and EMS is joining us, and we're very excited about that work. It will run for the next 9 months, and then we hope to deliver a strategic plan at the end of September that could address an infrastructure on how we could look to better ensure that we have the right supports for folks in the island. There's another grant that was awarded at the same time. Some of you may have read about that. It was a $750,000 3-year care coordination grant. And several of the same leaders on that grant are working with me. So we will share a lot of ideas and resources and collaborate with the work going on in the larger grant. And again, make sure that Lopez is adequately represented, both the unique needs and desires for the future whenever these countywide efforts are underway. So that's part of my goal. And I think those really are the main things I'd like to share as far as what the hospital district is up to. We continue to kind of track what's going on in COVID and the vaccine, and stay close here. Our star attraction is back. So with that, I'm going to just end, and I will turn it over to Crystal and Bob to take it from here. Thank you.
Thanks, Anne. Yeah, Crystal, take it away. How's it going over there?
It's going well. Thank you. Thanks so much, Malia, for putting this together, and Jamie and Anne for participating also. I really just wanted to start with just taking a moment to share a little bit of gratitude for this community. I'm really just blown away by how amazing everyone has been with containing this virus. First of all, it's not an easy thing. And obviously people are social distancing, they are wearing masks, they're doing all of the right things, because I think the proof is in the fact that we've had very little spread on Lopez. So that's just wonderful. And I'm just really proud to be a part of this community that's just been fantastic. So that being said, obviously we here at the clinic are here for you, and we're not seeing a lot of COVID, but there's no excuse to be putting all of your regular maintenance and also any other health issues that people may be experiencing aside. We've been doing this for 8-9 months now, and I know people are staying home and they're doing the right things, but there's no reason to not be booking your wellness visits. If you are sick, we certainly want to see people come into the clinic. If you are not comfortable coming into the clinic, we offer telemedicine appointments. Those have been going really well for most people that are able to Zoom and do things like this. We are taking a lot of precautions here at the clinic. I know that might be a concern that some people have. So some of the things that we do here to keep people safe following all UW protocols are daily attestations of all staff health. So if there's even a twinge of anything weird going on, obviously staff stay home and we make sure to go through employee health and follow all of the steps. A lot of sanitizing, extra hygiene, masking. One of the reasons why Bob and I are not in the same room right now is because we would both have to wear masks, which would make it more difficult for you viewers to understand maybe where we're coming from. So we're keeping separate even in the building. So we keep all patients who have respiratory issues in a separate area. We're not mixing anyone up. So people can really feel safe and secure coming into the building and getting the care they need. So we just want to make sure we're encouraging everyone to take advantage of the providers we have, make appointments. We do keep 6 to 12 same-day appointments for urgent care if needed. It just depends upon if we have 2 providers or 1 provider. So there's that. Just keep it in mind. And just looking to see if I've left anything out. Oh, COVID testing is done 90% of the time outside in our drive-through area. So most people, whether positive or negative, have not even been in the building. I know for people with young children, a lot of people kind of tapered off with the vaccines and things like that. We want people to feel safe coming in and having those routine visits. So if there's any questions about anything, I'm here every day. Feel free to call the clinic number, press 2, and we'll get any questions you have answered. We're here to help. Thank you.
Thanks, Crystal. Oops, I was trying to show myself, but I'll just move it along to, let's hear from Bob if you're ready. You're still muted.
How's that?
There you go.
All right. Crystal covered a lot of the really good points, and thank you for having us on and letting us be a part of this forum. It's really, really nice. So COVID is obviously the big topic here, and the great news, as Crystal was mentioning, is that the case number on Lopez is vanishingly small. We've had 6 cases in 10 or 11 months, depending on where you start counting. One of those cases was actually not on the island. It was a person that got sick off island. It was attributed to us because this is where they live. So 5 real cases out of the 75 cases in the county. At least that's my recent count. So we're doing really, really well. And it's not an accident. It's because the people here are wearing their masks, they're social distancing, they're doing a fantastic job. So yeah, we're really proud of the folks on Lopez. We are the stars. I want to thank Crystal and the nurses for working their butts off during this thing. Lots of extra testing, lots of extra rescheduling and making time for patients to come in, not only for the routine care, but for urgent care, and also obviously interdicting this or inserting this COVID testing. They've done a fantastic job. And the nurses also for being on the front lines. I don't do much of the testing. I'm back hiding in my room in a sterile container. So they're really out there doing the job. It's great. I really appreciate it. The University of Washington, Crystal and I were at a meeting the other day, and they were talking about surge planning. And their reason for me bringing this up is that the UW is all over this. They are just leading the way on this, doing a fantastic job. And they developed a surge plan for us, which is probably going to be a moot point because I don't think I hope we're not going to see a surge on Lopez. We didn't see a post-Thanksgiving surge, and we're hoping we won't see one after Christmas. But in case we do, they have this all mapped out about how they will approach the clinics, how they'll approach the hospitals, how they might share staff between the various facilities to cover this. And really the thing that I would encourage everybody to think about is that even though, let's say you're 25 and you feel pretty certain that if you got COVID, you wouldn't get really sick, that's probably true, but you can still spread it. And as the numbers go up, especially with the anticipated Christmas surge, the hospitals get jammed, they get full. And so not only is there no place to put the COVID patients, but all the other stuff, the heart attacks, the strokes, the trauma, the bad pneumonias, the gastrointestinal illnesses, et cetera, all these things that need critical care, there's no place to put those people if all the ICU beds are taken. And so then what happens is those folks who are critically ill get put in a regular hospital bed on a medical floor where they do not have access to critical care. So think about the effects that you might have if you spread the disease to others and they get sick and end up at the hospital. So that's really one of the strongest arguments for wearing masks and social distancing. I'm probably saying things that you guys already know, but the Pfizer vaccine is out. It's a really tough vaccine to distribute because of the cold requirements. I think it's -70. We don't have storage that can do that. Most places don't. The Moderna vaccine, I just got off the internet and they're apparently this far away from approving that. So that'll be fantastic. Crystal already mentioned that we have telemed available for anybody who's worried about coming to the clinic. And one thing I thought was really interesting. Again, Crystal and I were on a meeting together virtually with UW staff, and one of the concerns was, hey, how come we don't have N95 masks at the clinic? And there's an effort being made to make those available. But here's the interesting part. Of all the UW neighborhood clinics, we probably do the least amount of testing, although we're doing what, Crystal, 6 to 8 a day at least, somewhere in there. Yeah, they're doing thousands, and their providers and nurses have been exposed multiple times. There's not been one transmission from a patient to a provider wearing these and the gear. So even though these aren't ideal, they're not an N95, apparently they work really, really well. So any mask you have is a good idea. So just wanted to pass that on. Other than that, I'm proud to be a part of this community-wide effort. We're all doing a great job. Thank you.
Thanks, Bob. Okay, well, looks like we already have one question that has come in. Someone is wondering if family or kids that are coming home for Christmas should get tested or can get tested at the clinic on Lopez. And Crystal, I saw that you typed your response, but I think it'd be good for us to articulate it out loud.
That's a fabulous question. As Jamie had mentioned earlier, things change so rapidly from day to day, and sometimes it seems like hour to hour with how our responses are to how we can test and whom we can test. We were really proud in, a month or so ago to be testing pretty much everyone across the board that wanted to be tested, whether they were symptomatic or not. What we did see after Thanksgiving was an uptick in the amount of testing in the system as a whole. So our labs fly down each day, including our COVID tests, and they go to Seattle to UW Medicine, where all of the UW tests are tested. We've actually done over 1 million tests as a network total. So there's a lot. And what we started to see was our 24-hour turnaround rates started to creep up to 48 and 72-hour turnaround rates when within the 2-week period after Thanksgiving, simply because it seems like some gatherings took place or things took place in, the greater Washington area, affecting our response time. So in response to that issue, we've really been paring down testing to test mostly symptomatic individuals, as well as individuals that require testing for procedures that they need that we don't want put off simply because of all of the effects of the pandemic. And we have had to do less asymptomatic testing as well as travel testing because it's all going to the same lab. And we would really, really have, it would be pretty terrible if people had to cancel procedures or surgeries simply because they missed their window in terms of getting their COVID results back, which I haven't seen any surgeries where there hasn't been a COVID test required. It's just mandatory at this stage. So before we're looking to test asymptomatic people, we really kind of need to get through the next couple of weeks and see how things are going to be going. Hopefully there won't be another uptick after Christmas because we only have, the staff and the supplies and the one lab. So we just want to make sure that we're being cautious in terms of how many tests we're sending because it really does affect the greater system. So that's where we're at right now. That's not to say that things won't change. We just really want to make sure that the people who come for testing for mandatory procedures or for work or for things like that can get their testing back in time. So that's really the concern. And of course, you know, we do have people coming to the islands and visiting. It's just what, you know, what families do, but we want to make sure that they're isolating as much as possible and if possible quarantining from the greater family, you know, just to make sure they're not symptomatic and things like that, because we can't test every single person that may want to be tested at this time in order to not flood that system, if that makes sense.
Okay. And then there's another question. If someone thinks that they might have COVID, what should they do? And how should they connect with the clinic?
Definitely start by giving us a call to be triaged, and that would be the 2245 number, option 2. You know, if we are on with another patient, it may roll that person on the phone back to the contact center, and they are perfectly capable of taking all the information down and it'll come to us electronically. But we definitely want to get all the details. We want to know, you know, if you felt like you were exposed, if you have a known exposure, how you're feeling. And in terms of the actual symptoms, Bob can speak more to that. But give us a call. We'll talk it over. We'll work through it. If you need to be tested, we will make it happen, and we'll make sure that we're treating the symptoms as well. And you know, we're seeing a lot of COVID testing, but we're also seeing other illness. We're seeing pneumonia, we're seeing bronchitis, maybe strep. So we have to be able to make sure that we're not just putting everything in the COVID basket if we have people that really do need a workup and need care. And you know, we want to see those people. And I'll turn it over to Bob to add more in terms of symptoms and what people should be looking for.
Sure. And I just wanted to leverage off of Crystal's previous comments about testing. The CDC has some real specific guidelines on that, and they basically include people who have symptoms of COVID-19, and I'll kind of run through those. People have had close contact with a confirmed case, and they get real specific. They say, have you been within 6 feet for 15 minutes or more? People have taken part in activities that might expose you, like, oh, I won't say it. A party at the White House. Yes, I will. People have been asked by their healthcare provider to get tested. For example, you know, for, like Crystal was mentioning, for a preoperative test. So the symptoms of COVID, there's a ton: fever, dry cough, fatigue, aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, rash, shortness of breath, chest pain. You know, it's kind of like any symptom that you could get with any upper respiratory illness that could be an indicator of COVID. And like Crystal was saying, if you suspect that you've been exposed, if you have these symptoms, then let us know and we'll arrange to have you tested. And those are really important, not only for the person's health, but also to prevent the spread.
Great. So someone's curious about, they are having a procedure done at a UW specialty clinic, which is requiring a COVID test. And it sounds like they are told they have to go to Orcas to get the test because Lopez is not one of the approved testing sites. Is this accurate?
Oh, I am so sorry. And I'm so glad you asked that question. I'm not sure why they would have given that information, but we're definitely approved testing site. All of our tests go straight to UW. So if it's actually, if you're having a procedure at another UW clinic, it would be in your Epic chart for them to see as soon as it's resulted. We absolutely can test you, and definitely, you know, you don't need to get on a ferry to Orcas, especially since there's some ferry issues going on right now. So certainly give us a call and press 2 and we will get you tested here at Lopez. You do not have to do that. So thank you so much for bringing that up.
Yeah, Crystal, you would know this number, but we've done hundreds, and they're available usually within 24 hours. So
Thousands.
Okay, thousands.
And I can
Okay,
attest to, the Lopez Clinic has actually done more tests than the Orchid Clinic. we recently learned. So way to go, Lopez.
So we have a string of questions that are related to the vaccine. And I'm not sure that there's a good order to do it, so I'll just start at the top. Does the information we have about the vaccine mean that we need to wait for the Moderna vaccine for Lopez? And what would be the earliest that vaccines may be available here on Lopez? I'm not sure who knows the answer to that.
Sure. Well, Crystal, chime in on this one too, but there was a move to start vaccinating the providers here and on Orcas and the nurses today, actually, and that got delayed for a variety of reasons. The county, I can tell you, is planning to wait for the Moderna vaccine, which doesn't have to be a million degrees below zero. Crystal, do you have any?
I know for a fact it's going to be a joint community effort. So I know UW is in close ties with the county. Anne has been in the loop. I'm sure Jamie as well. Because Pfizer right now is the only approved vaccine, and it's also the only vaccine that we have in Washington state right now, it's just going to be a little bit more difficult to send out to the islands. It's difficult to dilute. You have to keep it really cold. So there's just a lot of factors that come into play. So I know things are moving quickly. It just seems like it would be easier if we had the Moderna. We're just not there yet. So we're just going to have to stay tuned. But there's a few people in the loop and it'll be a community effort. I'm sure it won't just be the clinic or the pharmacy. So as soon as we have more information to roll out, we will, but we're all working together on it.
So I might just add one additional thing is, I think I mentioned it coming in. The county has weekly, the health department has weekly what we call partner calls that are specifically with the providers. And the vaccines coming into the county as a whole are coming through our providers. So our clinic will get it through from the UW system. Orcas will get it through the Island Hospital system, and San Juan will get it through the Peace Health system. So, and the pharmacy will get theirs. But the purpose of these calls, as Crystal said, is to coordinate, is to have a coordinated effort on how we get the vaccine actually in. And like we've all said, things are changing fast. We're confident it's coming, but things are changing daily as far as the amount or when.
Well, that sort of answers all of the relevant vaccine questions that were presented. Someone else is wondering if the antigen test or the molecular DNA test is something that people can get here. And is that like testing to see if you have the antibody?
Well,
like
there's basically two tests available. One's a PCR, which is preliminary chain reaction. That's where you take a swab and put it in the person's nose, and then they use a technique to amplify the RNA of the virus so if it's there, it's more easily detected. That's a genetic test, you could say. And then there's an antibody test that looks for IgM or IgG antibodies that show you've been exposed and that you have some level of immunity. And those are the two. Well, there's a rapid antigen test too, but we don't have that here. But anyway, those are the two main tests. And I guess the first one you could call a genetic test because it's an amplification of the virus's RNA or genome.
So for the antibody tests, people can get that done at the clinic.
They can, and that would be in the lab, a blood test.
Yep.
So I think that we're all aware of some new residents over the course of the pandemic, people that have moved to Lopez or have stayed here in second homes or what have you, visiting. And what should they do if they need medical attention to get into the clinic? Who should they call? What are the recommended steps?
So first of all, welcome to Lopez and the community. Definitely give us a call at the 2245 number. And what I would recommend is whether you plan on coming to the clinic or not. I mean, obviously people have their preferred providers, that they've had for years and years, but definitely take the steps to get registered and get your family registered, because what happens is if there's an emergency or some sort of issue, we don't want you to be coming in, you know, bleeding from a wound and having to give us your insurance card and all of that fun stuff and your name. We can just find you in the system and get you scheduled or add you to the schedule. So what that would entail is calling the main number, the 2245, and you can get registered, I'm pretty sure, all day between 7:30 a.m. and 7:30 p.m. with the contact center. So even when the clinic is closed before or after hours, when the time is right for you, you can call. They're going to take your demographics, they'll take your insurance, and just put it all into the system. And when you're ready to make an appointment, or if you have an urgent care need and you come in and give us your name, you will pop right up on Epic. If you don't have insurance, not a concern, still get registered. Join the practice, and we can talk to patients about different options for that as well. We just want to make sure that if people are going to be on Lopez for any extended period of time, we want them to be able to use the clinic when they have an issue. And it's really easy to do that when you do it when you're healthy and not when you're feeling really crummy and don't really want to, go through the registration process. So we encourage people to start that now before they get those winter colds or anything like that.
I'm curious, have you guys noticed a reduction in some of these common colds that usually are circulating this time of year, just given the efforts we've been making to distance keep masked?
Yeah, that's a really good question. The first data came from the Southern Hemisphere, so Australia, Brazil, etc. They saw a real drop off in the number of flu cases for the season. And the presumption was that it was because people were masking, etc. So to date, and I haven't looked at the website today, but the last time I looked, there have been no flu cases reported in Washington State. Lots of people tested, but no reported cases. And that's a trend nationwide. The data on other stuff like adenovirus and Coxsackie and rhinovirus and all those, it really isn't available because, they tend to cause mild disease and they don't really test for them. But presumably the measures that stop one virus or retard it will do the same for the next.
Well, there's one silver lining. Okay, here's a follow-up question to what you were just talking about, Crystal. Someone wants to know if you are registered at the Lopez Clinic. Are you registered at all clinics through UW Medicine?
That's such a good question and a great point. Yes, if you've registered at any UW Medicine clinic or if you've been seen at Harborview or Valley or any of those entities, you will be in the system. You don't have to re-register. Even if it was from long ago, you're still in the system. So what that would be is just updating your demographic information and just making sure that we know where you are and we have your updated phone number and things like that. But you don't have to re-register. And if you register with us, you are in the official UW system. Great question.
And then here's a follow-up to our antibody test conversation. What would be an acceptable reason to ask for the antibody test?
Well, if you think you've been exposed, if you have a good reason to believe you've been exposed and you had, certainly if you had symptoms, although, about 40% of people infected with COVID are asymptomatic. So really, if you think you've been exposed, you could get the antibiotic test. The flip side of that is the CDC is recommending that whether you've had exposures or not, you should still get the vaccine. So if you if you thought you were exposed and you got the test, and incidentally, we've had 0 positives on that particular test on Lopez, you could get the antibody test to see if you've had the disease. But we don't know, well, we know better now that seems to infer pretty good immunity to a repeat infection, but still the CDC is recommending that you go ahead and get the vaccine anyway.
Okay. Well, those are all the questions. I'll give people just one more moment to think of any that they want to throw your way, and then also offer the opportunity for any of you to give some sort of closing remarks or final thoughts before we end. I don't see any more questions coming through. So would anyone like to say any final words? Oh, wait. Oh, someone just said thank you. Yes.
Well, I'd like to say thank you too to Anne and Crystal and Jamie and everybody and you as well, Malia, just for organizing this. And it's a huge county effort, and we really appreciate it. This is not any one group or person that's making this happen, meaning we're keeping Lopez virtually disease free as far as COVID is concerned. So I appreciate that.
Yeah, I would just like to say thank you as well for this opportunity and just for reiterating all the hard work that goes on in the clinic. We have a small population, and it's in the scheme of things, a relatively small clinic, but they make a really big impact and a pleasure to work with. From my perspective, it's a great partnership, and we look forward to doing great things together in the future.
So thank you also, Malia, from me. We need to continue to take care of each other. With the CARES Act funding running out and other things, we're going to face a couple months here of intense need. So look after your neighbor. And with that, wash your hands, keep your pod small, wear your mask. Thank you.
All right. Thank you. Crystal, do you want to say anything?
I just appreciate the time, and my phone's ringing. Sorry. Thank you so much, and keep up the good work, everyone.
Likewise. Thanks so much to you guys. And happy holidays, and take care, everybody.
Thank you.
Bye.
Bye-bye.
Okay.